Hi everyone. Today in this video we are going to discuss about risperidone. How this drug acts as antipsychotic, what is the mechanism, side effects, precautions and clinical indications of risperidone we will discuss in this video. So risperidone is one of the antipsychotic that is used to treat schizophrenia, which is one of the psychotic disorder associated with hallucinations resulting in wrong perception, similarly delusions, wrong judgment, along with some dementia and apathy in the patients, lack of initiation. All these symptoms are collectively known as schizophrenia. So here risperidone acts as antipsychotic and particularly it is classified as atypical antipsychotic. That means this drug is a new generation antipsychotic compared with the typical category, and theoretically this drug produces less extrapyramidal side effects compared with typical antipsychotics. But even extrapyramidal side effects are less pronounced, still it produces few of the side effects like tardive dyskinesia and neuroleptic malignant syndrome. But when compared with the typical agents, risperidone is having some more efficacy and less adverse effects. Similarly, risperidone can also be used in the treatment of bipolar mania. In the bipolar depressive disorder, the mood of the patient swings from depression to the mania as well as mania to the depression, where the mania is the hyperactive phase resulting in the irritability, agitation, increased appetite. In these situations, risperidone can be used to control the manic phase in the patients. So this drug can be used as a monotherapy for the treatment of bipolar mania. Otherwise, it can be used as a combination therapy. This drug can be given with other drugs like the lithium. Lithium is an anti-manic agent. Similarly, other drugs like valproate, they can be combined with the risperidone in order to treat the bipolar mania. Similarly, third indication of risperidone is to control the irritability that is associated with autistic disorder. Again, this is a condition where there is a hyperactivity, particularly observed in the children. In such conditions, the irritability can be controlled by risperidone. In this way, risperidone is useful in treatment of schizophrenia, bipolar mania, as well as irritability in the autistic disorder. So today in this video, we are going to discuss about this risperidone. What is the chemical nature of this drug? This is the structure of risperidone, and here we can observe one of the heterocyclic ring system where benzene is fused with isoxazole ring system. So this is nothing but benz-isoxazole. So risperidone is a benz-isoxazole derivative which acts as atypical antipsychotic agent. Now let us see how this drug acts. Just similar to the other atypical antipsychotics, risperidone also blocks different types of receptors. At few of the receptors, it produces therapeutic action. At few of the receptors, it produces adverse reactions. For instance, this drug acts as an antagonist at the D2 receptors, dopamine 2 receptors, which are mainly responsible for psychotic symptoms. So by blocking these receptors, it produces antipsychotic activity. Similarly, this drug also blocks 5-HT2 receptors. So the action of risperidone on D2 as well as 5-HT2 receptors results in the therapeutic actions. Apart from these two receptors, risperidone can also block other receptors such as H1 receptors. So when these histamine receptors are going to be blocked, it produces some sedation in the patients. Similarly, it blocks the muscarinic receptors, resulting in few of the anticholinergic side effects like dry mouth, constipation, urinary retention. And finally, this drug also blocks alpha-1 receptors. These alpha-1 receptors are responsible for vasoconstriction, therefore maintaining the blood pressure. So when these receptors are blocked, it results in orthostatic hypotension. In this way, risperidone produces different types of side effects by blocking the multiple receptors. And even by block of 5-HT2 receptors, it can also increase the appetite, resulting in the weight gain. So weight gain is another important side effect related to risperidone. So this is a presynaptic neuron which is storing one of the neurotransmitter, that is the dopamine. We know that the overactivity of the dopamine in the mesolimbic and mesocortical pathway mainly results in the psychotic symptoms. Now, this dopamine can be released and it can act on the postsynaptic neurons which are equipped with D2 receptors. During the calcium-mediated exocytosis, the presynaptic neurons are excited and it results in the release of dopamine, and this dopamine can act on the postsynaptic D2 receptors. This results in the postsynaptic stimulation, resulting in the stimulation of psychotic symptoms in the patients. So when this dopamine is excessively firing, it results in the increased postsynaptic neuronal excitation, resulting in hallucinations, delusions, and other psychotic symptoms in the patients. The dopamine which is going to be released can also be taken into the nerve terminal by endotropin transporter, dopamine transporter. Now this dopamine can be re-entered into the presynaptic neurons through this uptake transporter. Similarly, another mediator responsible for psychotic symptoms is the serotonin, 5-HT. This 5-HT can also be released and it can act on the postsynaptic receptors which are expressed with serotonin receptors such as 5-HT2 receptors. Now again, here serotonin can be released and it can act on the 5-HT2 receptors, resulting in postsynaptic stimulation. Just like the dopamine, 5-HT can also stimulate the psychotic symptoms by acting through 5-HT2 receptors. And again, here the 5-HT can be uptaken into the nerve terminal by one of the transporters, serotonin transporter, through which this 5-HT can be reuptaken into the presynaptic nerve terminal. In this way, dopamine as well as 5-HT can produce the psychotic symptoms by acting on their corresponding receptors. Now here risperidone is an atypical antipsychotic. This drug can block D2 receptors, thereby reduce the dopamine activity. And apart from this drug can also block the 5-HT2 receptors, resulting in decreased serotonergic stimulation. In this way, risperidone produce antipsychotic activity by blocking both D2 as well as 5-HT2 receptors. What are the precautions? One of the important precautions of risperidone is that this drug can increase the cerebrovascular events. Particularly, it can increase the risk of stroke, ischemic attack as well as death in the patients. So this drug should be carefully given in the elders who are having cerebrovascular disorders. Particularly in the elder patients with age greater than 73 years, the risk of stroke and death may be increased with use of risperidone. Similarly, another important precaution is that risperidone can precipitate one of the syndrome, neuroleptic malignant syndrome, NMS. This is a syndrome that is associated with the neuroleptics, that is antipsychotics, and it can increase the muscle spasm, muscle rigidity, and increase with the body temperature, which is fatal in the patients. We can observe few of the symptoms like muscle rigidity and hyperpyrexia, an excessive increase in the temperature, that body temperature may be raised greater than 106 degrees Fahrenheit, some confusion, altered mental status in the patients, tachycardia and diaphoresis, excessive sweating, irregular blood pressure along with some irregular pulse in the patients, and rhabdomyolysis. It may result in muscle spasm, muscle rigidity, myalgias, and finally it can also precipitate the rhabdomyolysis, dissolution of the muscle fiber, and finally it can also result in acute renal failure. So all these are significant side effects that can be precipitated by risperidone, and these are collectively known as neuroleptic malignant syndrome. Of course, this side effect is not only observed with the risperidone, it is associated with many of the antipsychotics. So whenever these symptoms are observed in the patients, immediately the drug should be stopped, and any other drug which again produce neuroleptic malignant syndrome should not be used in the patients. Third important precaution is that risperidone can increase the tardive dyskinesia. This is one of the extrapyramidal side effect. Tardive means it is slowly developing. Dyskinesia means disturbance in the kinetic movements. So this tardive dyskinesia mainly involves involuntary movements in the patients, and it is slowly developing after the use of the drug, but it is irreversible in nature. So even by stopping of the drug, these involuntary movements may not be suppressed, So whenever the first symptoms of tardive dyskinesia is observed in the patients, the risperidone should be stopped in order to prevent irreversible tardive dyskinesia. So within the patients, we can observe a few of the symptoms such as protrusion of tongue and lip smacking, eye blinking, difficulty in swallowing as well as difficulty in breathing. So if any of these symptoms are observed along with other involuntary movements, then risperidone should be stopped. So these symptoms should be carefully monitored in the patients when this risperidone is prescribed, and particularly the risk of tardive dyskinesia is more pronounced with increased duration of the treatment as well as dose of the risperidone. That's why on chronic treatment as well as with the high dose of the risperidone use, it may precipitate tardive dyskinesia. Similarly, risperidone can also increase the hyperprolactinemia, increased prolactin levels, which results in the galactorrhea, increased milk secretion, and gynecomastia, enlargement of the breasts. So this hyperprolactinemia is again because of blocking of dopamine receptors in the tuberohypophyseal pathway. Normally, dopamine is going to control the prolactin levels, but when the dopamine is going to be antagonized, it results in the increased levels of prolactin, resulting in hyperprolactinemia. But the increased prolactin levels may affect the HP axis. This HP axis involves hypothalamus, pituitary, and adrenal cortex. Now, from the hypothalamus, one of the hormone that is going to be released is the GnRH, gonadotropin releasing hormone. This will stimulate the release of gonadotrophs, that is a follicle stimulating hormone and luteinizing hormone. These gonadotrophs are essential to release the testosterone as well as estrogen in the males as well as females respectively. Now this hyperprolactinemia produced by risperidone may produce an autoinhibition on the hypothalamus, so gonadotrope releasing hormone is not released, which results in the decreased follicle stimulating hormone and luteinizing hormone. Finally, it leads to impotence in the patients. So again, these side effects should be considered when this risperidone is used for prolonged period. Finally, risperidone can also increase the hyperglycemia, which may precipitate the diabetes mellitus, or in the patients already having the diabetes, this risperidone produce further increase in the glucose levels, and it can also precipitate orthostatic hypotension, which results in some dizziness as well as tachycardia in the patients. So whenever this drug is given, a sudden dropping may be observed in the patients because of orthostatic hypotension. This side effect is mainly due to block of alpha-1 receptors. Similarly, risperidone can also increase the agranulocytosis, resulting in neutropenia, leukopenia. So there may be an increased risk of infections in the patients, which should be carefully monitored. What are the side effects? Few of the important side effects of risperidone include somnolence, increased sleepiness, as well as sedation in the patients. Increased appetite can be observed, which results in the weight gain. This side effect is because of the block of 5-HT2 receptors, some fatigue, insomnia, lack of sleep, akathisia, restlessness, dry mouth, constipation, which are the anticholinergic side effects, nasal congestion, headache, drooling, excessive salivation, similarly tremors, which indicates the Parkinson-like symptoms. So since this drug is going to block the dopamine receptors, it may precipitate the Parkinson-like symptoms like the tardive dyskinesia, drooling, tremor, akathisia. Along with these side effects, it can also precipitate neuroleptic malignant syndrome and orthostatic hypotension. And finally, it can also lead to cerebrovascular events like stroke, ischemic attack, and death in the patients, particularly in the elder people. How it is given? This drug is available in different forms. It is available as tablet form, otherwise ODT tablet, orally disintegrating tablet, and it is also available as a solution for oral purpose, otherwise dry powder, which is reconstituted, used for injection. It can be given by either intramuscular or subcutaneous injection, and the dose of this drug depends on the type of clinical use. For the treatment of schizophrenia, initial dose is started at 2 mg per day, either as a single dose or divided doses, and increment of the dose may be made at a rate of 1 to 2 mg per day, but these increments should be done after 1 day of the treatment, and the maximum dose that can be achieved is within the range of 4 to 8 mg per day. Similarly, for maintenance of this schizophrenia, the usual dose is from 2 to 8 mg per day. And this drug is also used in the bipolar mania, where the dose is variable at 2 to 3 mg per day. So that's about this risperidone. Risperidone is an atypical antipsychotic which chemically belongs to benzoisoxazole category. This drug shows antipsychotic activity by blocking the D2 receptors as well as 5-HT2 receptors. Apart from these receptors, it can also block other receptors, which results in few of the adverse reactions. It can block the H1 receptors, resulting in sedation, muscarinic receptors, resulting in anticholinergic side effects like dry mouth, constipation, urinary retention, and blurred vision. It blocks alpha-1 receptors, resulting in orthostatic hypotension. It blocks 5-HT receptors, resulting in weight gain. This drug can also be used in the treatment of bipolar mania, where it can control the manic phase in the patients. And this drug can also be used to control the irritability in the patients associated with autistic disorder. This drug should be carefully given in the elder patients, particularly age greater than 73 years, where it produces cerebrovascular disorders like stroke, ischemic attack, or death in the patients. And this drug may also precipitate one of the syndrome, neuroleptic malignant syndrome, which is associated with muscle rigidity and hyperpyrexia, which is a fatal condition that should be closely monitored when this drug is prescribed for longer periods at high dose. And it can also precipitate the Parkinson-like symptoms or tardive dyskinesia, which is irreversible extrapyramidal side effect. It can also increase the prolactin levels by blocking of dopamine receptors, which may lead to gynecomastia, galactorrhea, and impotence in the patients. Finally, it can also increase the glucose levels, resulting in the hyperglycemia and orthostatic hypotension due to block of alpha-1 receptors. This drug is available as a tablet form, solution, as well as dry powder, and the dose depends on the type of clinical condition. The initial dose is started at 2 mg per day and the maximum dose is 8 mg per day for the treatment of psychosis. In the bipolar mania, this drug can be used either alone or in combination. When it is used as a monotherapy, the dose of this drug may be variable from 2 to 3 mg per day. So that's about this risperidone. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.